So now we'd like to turn to our panel of experts, and thank you so much for your comments, Richard and Mark. So to provide more context and perspective on the pace of changes taking place in the healthcare market, we'd like to turn to other experts in the field. What are the companies involved in M&A activity offering consumers? Will the market support disruption, and how are issues related to access and quality of care going to be tackled? To get answers to these questions, please join me in welcoming Emily G., healthcare economist at the Center for American Progress, Nancy Roman, President and CEO of the Partnership for a Healthier America, and Corey Capps, partner at Bates White Economic Consulting. My colleague Peter Sullivan, healthcare reporter at The Hill, will lead this discussion. Peter, over to you.
Thanks. Thanks everyone for joining. Yeah, so now we've heard from our members of Congress, so we're just going to dive in a little deeper with our expert panel here. So I thought maybe I'd start with Emily and just talk about kind of what makes kind of healthcare markets different. I mean, you can go into a store and you see a price on, your groceries. It's kind of easier to have a market there. Maybe, we all know when we go to the doctor, that's not necessarily how it all works. So what is kind of the challenge there in trying to have a healthcare market, and how does that play into what we're seeing with mergers and acquisitions?
Sure, so I think one big difference between healthcare and ordinary consumer goods is that most of us generally aren't going out and shopping for an MRI or shopping for an emergency room visit. What we're doing is we're buying health insurance, and in many cases, it's our employer who does that initial round of shopping for us. At a relatively medium to large-sized firm, you might get a choice of 2 different kinds of health plans, and that's it. And so when we think about mergers and consolidation, consolidating insurers, consolidating providers, well, that does increase the bargaining power, and often those entities would argue it increases their ability to coordinate care. That value doesn't always get passed down the chain, and a lot of times the cost savings is captured by those entities and not passed down to consumers. So I think we need to think about, can consumers actually shop in this market? And what's the value that consumers are getting, both in terms of lower prices and better quality care?
Right, and going down to Corey, I guess, what we've started seeing has been a very active space for mergers. I mean, we've seen some of the health insurer mergers got blocked last year. What is that kind of, what lessons have we kind of learned from that, and what does that tell you about where things are going now? Does it mean we're going to be seeing vertical mergers instead of horizontal mergers, or what does that kind of tell you?
Sure, I think we all learned relatively early on that if a stove is hot, you don't touch it or don't touch it again. So the DOJ blocked 2 insurer mergers that combined firms that sell the same products in the same geographies. So that was Aetna Humana and Anthem Cigna. Less renowned, but still going on steadily. The FTC has been blocking horizontal mergers of hospitals and in some cases physician groups. So again, when they're direct competitors and there aren't a lot of other competitors, the antitrust agencies are likely to block those. So if the horizontal door is closed or that stove is hot, then you look to other doors and avenues. So rather than scale, you're starting to see more scope type of plays. And so now we see a wave of more vertical integration. And the ones that are getting all the attention, certainly the Amazon JP Morgan venture, which is a form of backward integration, potentially at least. We're not sure what they're going to do, and I don't think they are either. You're also seeing the PBM insurer deals. And alongside that, you're also seeing insurers buying up physician groups, which is sort of alongside or maybe replacing or taking the baton from a series of hospitals buying up physician groups. So now we have 2 competing buyers as physician groups look to scale up. We also have the AT&T ruling that came out 10 days ago or so, which sort of shows that the antitrust stove is less hot when it comes to vertical deals, although that's only one, not a trend yet.
Right, and so finally, Nancy, I mean, what is this, if you're a patient, what does this kind of mean? To some extent, does it matter to you, who is owning the practice or hospital that you're going to? Does it matter in terms of the price that you're paying, or what kind of things should we look for in terms of how this is actually affecting people?
Well, I don't think anyone can purport to know how everything will play out or what the unintended consequences could be. But one of the reasons I'm excited to see all this activity and potential merging is because it's disruption, and I think the system badly needs to be disrupted. And that allows for opportunity, I think, in one of the most overlooked areas, and that is preventative care, and really using some lower cost, more common sense things to prevent diseases before they happen. I mean, just to use a few statistics, 38% of the public lives with obesity right now. Okay, 100 million people in the United States of America have pre-diabetes currently. By 2030, it's expected that 50% of the nation will have obesity. Well, there are 60 diseases and conditions associated with obesity, and we spend 20% of our healthcare dollars annually on these kinds of things. So one of the problems with the current system is it has trouble dealing with prevention. And so one of the things I like, and I could talk about this for a while, but one of the opportunities I see in mergers, when I ran the Capital Area Food Bank, we tried to do a lot of work providing vegetables in hospital settings for patients that didn't have access to good food. But it was very, very, very difficult for medical providers to get into the perishable food space. But you have a company like CVS, they already have a supply chain that deals in perishables. And so you can imagine a world where the Minute Clinics would be advising people to take walks and eat well, and the things that they would need to be eating could be carried on site. And you don't know exactly how these things would unfold, but clearly there's opportunity there.
Right. So now I'll just throw it open to whoever. Well, Corey mentioned the JP Morgan, Amazon, Berkshire, whatever we're calling that. What do you guys, that seems to be a kind of something people are a lot of wondering about. I mean, what do any of you guys make of that? I mean, do you think that there's a lot of potential there? Is there kind of too much hype for what it actually is going to be? Or what are kind of thoughts on that?
So I agree with Corey that I think we have no idea what they're doing. But I think, two interesting things about it. One, that it is a venture that's an example of how you can collaborate without actually merging. I think the second thing is it's getting a lot of hype. There are about 1 million people nationwide who work for one of those three companies, Amazon, JP Morgan, or Berkshire Hathaway. But we have a lot of opportunities already on hand for innovation. So for example, the Center for Medicare and Medicaid Innovation, Medicare has about 60 million. That's more than 60 times the size of the three-company tie-up. And we have this opportunity to innovate through CMMI, to test whether models are actually working, and to give providers an opportunity to try out different ways of lowering costs and increasing quality.
We often hear Institute of Medicine quoted for saying 30% of medical spending is wasteful. If they're only half right, there's a tremendous opportunity both internally for the triumvirate to lower their own costs and make themselves more competitive, or the shareholders better off. So there's definitely potential there. Of course, there are two dueling aphorisms. One is Trump, of course, saying that who knew this was complicated. At least Atul Gawande knows it's complicated. He does not yet run a business, but he will be, or is now. The other one, I remember in the 60s, Andy Grove, who was one of the three founders of Intel, was asked what they're going to do. He said, I don't know, we're going to try to do something that no one else is doing. And that worked out pretty well. So we'll see which applies.
Right. So Nancy, you think kind of this, you mentioned CVS. I mean, do you think kind of having more retail, some people have talked about maybe Walmart is going to do something. You think kind of putting more healthcare into retail, I guess, through mergers could be a helpful thing to happen?
Again, as a disclosure, M&A is not my expertise, but healthier living, I have worked for the last 20 years at the United Nations, at the Food Bank, and currently at Michelle Obama's Partnership for a Healthier America, really trying to work on health and integrating it. And I think one of our problems is we're so siloed. You have the hospitals, then you have the doctors, then you have pharmacies and pharmaceutical industry, and you don't have a coming together. I do see that having the retail space involved sets up opportunities to integrate it into our life. And you know, these issues that we talk about in the abstract, the high cost of drugs and every other thing, as a culture, I know this can sound a little loose, but it's really what we have to contend with. As a culture, I'm just facing this, you know, my dad now has gone on blood pressure medication. And I wish that when he picked it up or, you know, went to the Minute Clinic that they were saying to him, you know, before we up your dose, start taking a 30-minute walk after dinner. You know, I wish those conversations were embedded. So what I see is an opportunity where you have healthcare on site, access to have perishable food on site, counseling for nutrition and health on site, because until we start embedding some basic preventative measures into our daily actions, where people go and shop and live, we're going to be spending all the money on end-of-life sick care, and we all know those statistics, and that isn't really working out very well for this economy or for people's health.
You mentioned the cost of drugs, so maybe Emily or Corey, I mean, we've seen some of the pharmacy benefit managers could be involved in these mergers with Express Scripts or others. I mean, do we think that that can help tackle drug pricing if you know, insurer and PBM become, you know, merge and become the same thing, or is that just kind of rearranging deck chairs, or do you think that will make a difference?
Well, you have to look at what drives profit for a firm. So right now, there are certain costs in the healthcare system, for example, costs related to an inpatient episode of care that the PBM doesn't care about. So there's at least a potential for better coordination between drug regimens and adherence, and caring about total cost for the population, which is what the insurer who has to pay for it at the end of the day cares about. So there's a potential to align incentives through vertical mergers that combine insurers and PBMs there. It's possible that better contracts could achieve that same outcome.
I think there's a question of whether we actually need these companies to merge formally in order to get the kind of care coordination. And so I think there are a lot of things that policymakers could do to help align those incentives. And I think you know, we also need to make sure that even if, you know, there's greater synergies between, say, PBMs and pharmacies, that those savings are passed down to consumers in the form of lower premiums or lower out-of-pocket costs.
Right. I guess another question for any of you, for the, just when talking about healthcare markets, is what are consumers or patients kind of informed enough to be able to, you know, most people, I guess, going to the doctor, you know, are mostly just worried about their illness. They're not looking at the price or anything like that. You know, is it possible, I guess, for people to be informed enough, or do people not need to be super informed for kind of the market to change and become more competitive?
I'll just say, I'm skeptical about, you know, the ability of people to shop. You know, I know Senator Cassidy is a big proponent of HSAs. I don't think we should pretend that, you know, greater price transparency or HSAs are a silver bullet. What we know from studies is that when consumers are faced with greater cost sharing, they cut down on both low value and high value services, and that's certainly something that we don't want to do. You know, most of us have insurance, I hope, and, you know, I think that we've all found that to be a very daunting task to shop for insurance, and I can't imagine having to also, you know, be in the position of shopping for my anesthesiologist and, you know, for a hospital and for, you know, specialty care. So I think there's a limited tool. I think competition only works when you can actually shop, and only about 40% of healthcare services are actually shoppable.
Well, I do agree with you about, you know, you don't want the poor consumer to have to sit around figuring out complicated medical information. But on the other hand, you know, again, I think some of these things, a piece can be the answer. For example, you know, when I was crazy enough to be trampolining with my daughter about 10 years ago and trying to do the same triple split she did, I tore my ACL very badly, and I had to have it replaced. And they gave me a choice. They said, you know, look, you can have it replaced with a cadaver's ligament or with your own hamstring. Well, anyway, that was a choice I made. Well, I chose the cadaver's ligament, but I only learned later. The hamstring was $9,000. The cadaver's ligament was $37,000. And my insurance paid for everything, so I was never confronted with any information. So I think sometimes just bringing a little light, you know, you're so detached from the cost of everything that I do think some transparency could help while not holding the end-line patient accountable for every last bit.
Right. So there could be a balance there. Yeah, Corey.
I don't think transparency can never be bad, and
Yeah.
9,000 and 37,000 may be important, and it may be that the 37,000 could have been 30,000 at some other provider,
Yeah.
so that type of transparency can help.
Yeah.
But I want to add to Emily's point that you can only get so far with putting skin in the game for patients because the distribution of healthcare spending is highly skewed, so 5% of the population accounts for half or more of medical spending. All of that is outside the deductible, out-of-pocket maximums, and so forth. It's not affected by financial incentives at the patient level, so it may tweak the curve, it won't bend it.
But can I just say one thing? And informing patients, it's not always informing them about the complicated choices they have among and between drugs, but informing them that if they take a walk every day for a half an hour, their blood pressure will drop. Informing them, about some just common sense things that can reduce their health care costs and increase their health care. That, I think, can go a long way. It doesn't require expertise. Minute clinics could do it. That should be much more thoroughly embedded in our lifestyle.
I think we're going to open up to some audience questions now. So if you have a question, you want to raise your hand, and then a mic will come to you. Right here up front. Why don't you wait for the mic to come?
Hi, Miranda Jam from Blue Cross Blue Shield Association. Do you think that mergers in the healthcare sector will ultimately help us to address the social determinants of health?
Well, that's been a bit of what I've been trying to, address. Throughout, one of the things I was thinking about with the Berkshire Hathaway, J.P. Morgan collaborative, which I think is positive just because, again, it's disruption. But given who the employees are of those companies, it's not likely to confront the issues of those most in need and the low income, part of the spectrum. And I agree very much with Emily. Look at the size of Medicaid and Medicare treating the lower and middle classes. There's a lot of opportunity there. So no, I don't think mergers will solely address that, but the retail aspect does allow us to touch people where they are, and it's a conversation we have to have because the rates of diabetes, obesity, all those things, as you know, are much higher among lower income populations.
I don't see a direct connection between private sector mergers and social determinants. It does seem like a ripe area for policy measures, but it's, there's things we can count on the private sector to accomplish and things we probably shouldn't.
Right.
I also think in the context of employer insurance, it takes a while for, something like a walk a day to materialize into cost savings. What's one of the problems is that, even if my employer today convinces me to take, or my insurer convinces me to take 30-minute walk every day, in the long run, that might be, save me from having diabetes or other conditions when I'm older, but it won't be I won't necessarily be with that insurer or that employer a decade or 2 decades from now.
But even in the meeting, that can have an impact right away just on blood pressure. So part of it is an education, but it is true about the long term.
Any other questions? Yeah.
Hi, I already asked a question, but so my name is Shim. I'm a medical student, and my question is: could you discuss, this is open to all of you, could you discuss how patients' moral hazard might be impacted by private sector mergers and acquisitions?
Well, so moral hazard is basically the idea that if you're not paying for something, you're going to consume too much of it. Right now, I think Emily alluded to the fact that consumers don't make good choices. They systematically will consume more health care if you make it more expensive, and that will include both low value and high value things. And if you make it more expensive, they'll consume less, and they'll do that kind of bluntly. So you either need to incent physicians to help the patients make better decisions because they're not making it on a cost-benefit basis because they may know the cost to them, but they don't know the benefits to them. or possibly transparency tools to better educate consumers. And so any sort of merger that drives more primary care incentives and better medical decision-making on a cost-benefit would potentially affect that. But again, it may be an indirect, not a direct connection that I see.
Any other quick questions? No? Well, I think that does it then. Thanks to our panel, and thanks all for coming.
Thank you.